So to answer the question, what is insulin resistance and how to measure it and how important it is for a lifestyle modification? Well, insulin resistance starts much earlier to the day of diabetes. So it means if we talk about insulin and try to measure it, we can do a primary prevention of diabetes and not to wait till the blood sugar rise and then try to control it. Usually if a person is having a sedentary lifestyle with a high carbohydrate diet and not able to give time for exercises, he tends to become fat. When we hear the normal or a common term fat or gaining weight, it means the person is developing a mild variant of insulin resistance. So insulin resistance per se means the body finds it difficult to dispose of the extra glucose load, and hence it needs lots of requirement of extra insulin to push it onto the fat stores. So once this happens, the person tends to become overweight, and then he looks at himself in the mirror and says, or in the weighing machine and says, he's become fat. So the whole fact that the person is becoming overweight means if left alone, that extrapolates into diabetes in some years from now. So the best way to measure insulin levels would be to check a fasting insulin levels and also simultaneously do a fasting blood sugars and check the ratio of insulin, a measure of insulin resistance called HOMA-IR. So when we get this data, we can probably put them on a medication if the values are very high, or just recommend a good dietitian with a diet modification and an exercise routine to bring down the weight and hence reduce the insulin resistance.